Good evening. I'm going to talk about why it's important to have an eye exam. Most people do not think about their health unless they are in pain or something happens that's painful or they can physically see it. This can be a downfall for some people who might have health problems and not realize it or choose just to ignore it. Um, Eye exams are important not only to help see, but also to help prevent future and possible health problems that's going on right now. An eye exam helps detect eye problems at their earliest stages when they're most treatable. Regular eye exams gives you eye doctor a chance to help you correct or adapt to vision changes and provide tips on caring for your eyes. Several factors determine how frequently you should be seen by an eye doctor, such as age, health, and risk of developing eye problems. Getting your eyes examined is a way to check on your blood pressure. By viewing the blood vessels in the retinas of your eyes, your eye doctor is able to look for early signs of high blood pressure, also known as hypertension. High blood pressure has been called the silent disease because it has no symptoms. According to the American Heart Association, it affects 76.4 adults in the United States. Due to your eye's demand for oxygen, tiny blood vessels in the eye's retinas can easily be damaged by high blood pressure. During your eye exam, your doctor can check a condition called hypertensive retinopathy and note any changes throughout the years. This is pretty much what the doctor's looking at. This is the optomap, and he's checking. This is your optic nerve, and he's checking your blood vessels. It's all around in there. I'm sorry, it's not very clear. Most people with glaucoma do not notice changes in their vision. It usually affects the peripheral vision or the side regions, and so it's hard to notice. The time that a patient notices vision loss, usually the disease is advanced. Open angle glaucoma is the angle in your eye with the iris meets the cornea. The eye drainage canals become clogged over time, causing an increase in internal eye pressure and causes damage to the optic nerve. So this is when you go to the eye doctor and they puff that air in your eye that everybody hates. That's what we're checking for. According to Glaucoma Research Foundation, about 4 million Americans are affected by this and who didn't even know they have it. Unfortunately, approximately 10% of people who receive treatment still suffer from vision loss. And this is an example of glaucoma. The top one is regular vision, and the one in the middle is kind of the next step. And then as you can see on the third one, it just kind of closes in. This is what glaucoma does. According to the National Eye Institute, diabetic retinopathy is the leading cause of blindness in American adults. It's caused by changes in the blood vessels of the retina. Just how diabetes affects other parts of the body, it affects the eyes as well. Once again, there is no symptoms of vision loss until damage has already been done. So this is an example of diabetic retinopathy, which your vision starts looking like it's kind of spotted. You can tell. This is why it's important that people get their eye examined. There's just a few examples, but there are several other examples why people should go. A lot of people think that, well, I can see fine, I have problems far away or close up. They think that they don't need an eye exam. But really, that might be the case, but they might also have other things that's going on that needs to be checked on. Or if you have diabetes or high blood pressure, they can help follow up with that as well. So, thank you.